Test 1, 2. Test 1, 2.
I do. It's under here. All right, how we doing, Nick?
We are ready when you are.
Okay. Good afternoon, everyone. Good afternoon. I want to thank you for joining us today. Let me begin by recognizing our board members. Vice Chair of the Health and Hospital Committee, Alma Anaya, Commissioner Anaya, Commissioner Bridget Dnet, and Commissioner Donna Miller. I also want to thank our Cook County Health Leadership Team, beginning with the CEO of Cook County Health, Dr. Eric Mckitis, and our Chief Medical Officer for the system, Dr. Lauren Smith, and our Board Chair, Rael Garza. I'd also like to recognize the Chicago Abortion Fund, an organization providing critical health care services. We're making a major investment in reproductive health, and it reflects our values here in Cook County. This grant will support community-based reproductive health care, along with critical wraparound services that make access possible, things like transportation, lodging, and childcare. The Chicago Abortion Fund was selected through a competitive RFP process, and this $2 million award is scheduled to go before the Cook County Health Board of Directors for a vote later this month. I'd like to thank Kitsia Sharif and her team, Emily and Eleanor, for joining us today. Let me be clear. In Cook County and the state of Illinois, we trust women to make their own decisions about their bodies and their health. Illinois has become a safe haven for reproductive care, not just for women here at home, but for people traveling across the Midwest and beyond, places where abortion has been banned or severely restricted. It's hard to comprehend that today, our daughters, in my case my granddaughter, will have fewer rights than many of us had decades ago. And history has shown us something important. Making abortion illegal doesn't stop abortions from happening, it just makes them unsafe. Here in Cook County, women have the right to access abortion safely, legally, and without shame. In other parts of the country, that's not true. This means that women are being forced to carry pregnancies they do not want, or worse, pregnancies that are unsafe. Others must travel hundreds of miles to receive care. Some, in desperation, are left with no good options at all. These funds are meant to support women who live in Cook County, as well as those coming to our region in search of care that they've been unfairly denied in their own communities. We know that disparities in abortion access mirror broader social and economic inequities. Where you live and what you can afford should not determine whether you can make decisions about your own body. This is not just a local issue, it's a national crisis. And we must continue to fight, not only to protect and expand access to abortion, but also to codify reproductive rights across this country. I'm proud that Cook County Health continues to lead with compassion and integrity and courage on this issue. And I'm grateful to all of our partners who are helping make reproductive justice a reality. Now, I'd like to welcome Vice Chair Anaya to the podium and ask that each person introduce the person who follows. Thank you so much.
Thank you, Madam President. Good afternoon, everyone.
Good afternoon.
My name is Alma Anaya. I'm the Cook County Commissioner of the 7th District, representing the southwest side of the city of Chicago. I first off want to just thank everyone that's here, especially the wonderful individuals behind me. I know Commissioner Dnet and Commissioner Miller worked really hard when they first brought up this issue and you know, talking to us and really figuring out what needed to happen for us to continue to be a beacon of hope in many ways, especially around healthcare access, as well as Madam President Tony Preckwinkle, her team, Dr. Mckitis, and of course Chair Garza. I think it really shows the importance of how we are willing to stick together, both in the executive, you know, the legislative branch, and all the partners here in Cook County Health to ensuring the rights and healthcare access, especially reproductive access, as we see that they continue to be under attack. I'm honored to serve as the Vice Chair of the Health and Hospital Committee, where I continue to advocate for residents and that healthcare access that I mentioned, especially in our system that we have here locally. Today we are celebrating that Cook County took a commitment to reproductive health, and not only just a commitment, it wasn't only just a statement, but we did an investment in community-based solutions. We're currently living through a time where reproductive rights are rolled back. Instead of guaranteeing every person has the right to choose, we are seeing that these rights are being taken away from the federal government. While we live in the state of Illinois and we know that access to abortion is protected, we know that this is not the case for many of our neighbors in the Midwest. Cook County Health will continue to support people and communities in their journey to live healthy and safe lives. Providing wraparound services such as access to transportation, lodging, and childcare are critical components. I'm going to say that again, they're critical components because oftentimes they are an impediment that keep women in unsafe and unhealthy conditions. And that is a step forward in supporting someone through their reproductive health journey here in Cook County Health. We know that we are committed to ensuring that we're providing these services also in a culturally responsive manner. This also includes ensuring that patients receive services in the language that they speak, that they do not feel scared to coming up to us for a checkup or any appointments because of their immigration status or because they may not be able to have the ability to pay out of pocket. These are just some of the examples that really brings Cook County to meet the moment, especially in a political and a social climate that is not very friendly to women. This commitment I know we take to heart, and we will continue to do that. I will make some brief remarks in Spanish. Buenas tardes, mi nombre es Alma Naya y es un honor para mí servir como comisionada del 7º Distrito del Condado de Cook, representando al suroeste de la ciudad de Chicago. Quiero agradecer a muchas de las personas que están aquí hoy día con nosotros, como la comisionada Dnet, la comisionada Miller, a la presidenta Tony Preckwinkle, a Dr. Mckitis y a la persona aquí que sirve como presidente del comité de salud aquí en Cook County Health, Chair Garza. También tengo yo el honor aquí de estar con tantas personas que tienen los valores para servir a las personas y a las mujeres aquí del condado de Cook. Yo tengo el honor de servir como vicepresidenta del Comité de Salud y Hospitales del Condado. Hoy estamos celebrando el compromiso del Condado de Cook con la salud reproductiva y nuestra inversión en soluciones comunitarias. Actualmente vivimos en una época en la cual los derechos reproductivos están retrocediendo. Vemos los actos del gobierno federal en quitar nuestros derechos que se han luchado por décadas. Cook County Health continúa apoyando a las personas y las comunidades en su camino hacia una vida sana y segura, brindando ahorita servicios integrales como acceso a transporte y cuidado infantil son componentes críticos para una persona que quiere acudir o necesita apoyo con su salud y asesoramiento reproductivo. En Cook County Health estamos comprometidos a brindar el servicio de una manera centrada en nuestra cultura y lenguaje. Esto incluye brindar servicios a nuestra comunidad indocumentada y también brindar ayuda a las personas de bajos ingresos que quizás no vendrían a nosotros y tendrían preocupaciones en pagar. Así podemos tomar en cuenta el clima social y político que estamos viviendo. Este es un compromiso que tomamos muy en serio y estamos aquí para servir. Muchas gracias. And I would like to introduce fellow Commissioner Bridget Dnet.
Hello, everybody. My name is Bridget Dnet. I'm the Cook County Commissioner in the 12th District, which covers parts of Chicago's north and northwest side. I can't tell you how excited I am to finally be here today to help announce the grant recipient of the Reproductive Health Equity Budget Amendment grant we passed last fall. It is truly a full circle moment. Yet, I think we are all also filled with anger that in 2025, women have fewer rights than a generation ago. I'm angry that the campaign to make America more dangerous and less free for women, particularly poor women, has worked in so many parts of our country. Our first job as public servants is to protect people's health and safety, and reproductive health is fundamental to the health and safety of people in Cook County. Yet women and healthcare continue to be under attack. Anti-choice advocates with control of the federal government and the reversal of Roe versus Wade leave reproductive health access hanging by a thread. This means states like Illinois and counties like Cook have to step up. That's what we're doing today. We're stepping up to show our values of autonomy, equity, and freedom. On November 21st of last year, Cook County passed a balanced budget that included a $2 million budget amendment, the Reproductive Health Equity Budget Amendment, which I drafted in collaboration with Cook County Health, Commissioner Donna Miller, and abortion care advocates. When we were drafting this amendment, we knew investing in wraparound services for women seeking abortions would be increasingly urgent in a world where autonomy was under constant attack by a tyrannical federal government and oppressive states. We know Illinois is an island surrounded by more restrictive anti-abortion states, which is what makes today and this funding all the more critical. Congress recently tried to defund Planned Parenthood through blocking a Medicaid reimbursement. Thankfully, a judge declared the blocking of those funds to be a violation of First Amendment rights and said it may amount to, quote, legislative punishment. That's how this feels, right? Feels like punishment. Women are being punished, criminalized, and poor women disproportionately left to fend for themselves and even die. Healthcare providers are being punished. Doctors fear a chilling of their work, fearful of litigation and criminal prosecution in red states. Abortion refugees gather whatever resources they can muster to flee to freedom-loving states like Illinois and a freedom-loving county like Cook County. But still, despite our leadership at the state and local level, there are disparities in access to abortion care depending on people's income. So while I am angry, I am also hopeful and excited today because Cook County is once again leading the way. These funds will increase access to community-based health services, wraparound support, like Commissioner Anaya just mentioned, transportation, lodging, and childcare, which are critical. Groups who receive this funding do tireless and life-saving work for women and families at a very stressful time, and we are grateful for the work that you do. While this grant will not solve the underlying issues that got us to this pivotal moment, it will provide immediate and life-saving resources for women. I want to again thank Cook County Health for their collaboration, and particularly Kathy Chan for the work that she did, and Pam Casera and Dr. Eric Mckitis. They're truly my heroes. My dear friend Commissioner Miller for her leadership and collaboration in drafting this amendment, President Tony Preckwinkle for supporting it, Personal PAC and other organizations for their advocacy, and all of my colleagues that co-sponsored this budget amendment. Thank you all. And now I'd like to introduce the next speaker, Commissioner Donna Miller.
Thank you. Good afternoon, everyone. I'm Cook County Commissioner Donna Miller, and wow, here we are at this moment that brings so many different resources together, but it also shows unity of all of us working together to work towards access to women's reproductive health care. And we all know that it's not a privilege, it's a right. This belief has guided my work for decades, from serving on the board of Planned Parenthood, having the first Planned Parenthood actually open in the south suburbs, which is now an oasis in the Midwest. This is where we weren't even thinking about where we would be today when that Planned Parenthood opened. This is where every level of government has to really assess what the rights of women, we are supportive of the rights of women to make decisions about their body. Today, I'm incredibly proud to stand here with my colleagues and partners at Cook County Health to make this major step forward, securing $2 million for the funding of the Chicago Abortion Fund right here in Cook County. This investment is not just a financial commitment, it's a moral one. It really says that here in Cook County, we protect access to abortion care. We ensure that no person will be denied health care based on their income, immigration status, or zip code. And we will not back down to the political attacks on reproductive freedom. They might try us, but they're not going to succeed. I want to thank Commissioner Bridget Dnet and Commissioner Alma Naya, two fearless women who have stood shoulder to shoulder with me in this fight. Your dedication, persistence, and passion helped make this moment possible. And when we all work together, moments like this will continue to have a ripple effect, not just here, but across our country. I want to thank our incredible partners here at Cook County Health. With your leadership and compassionate care, this initiative will not only succeed, but it will magnificently succeed. Together, we are building a model that the rest of the country can look to during these uncertain times. Illinois is an oasis. We fought hard for many years to make that happen. We're not going to back down and let other forces take over. This is what it looks like when government, healthcare leaders, and community advocates come together with a shared purpose. We are doing the work, we are saving lives, and we are standing up for justice. And I'm proud to be associated with this leadership team. Thank you. So next, I'd like to introduce Cook County Board Chair Rael Garza, who's from the 6th District.
I didn't know you were tracking me. But that's cool. Hi, I'm Rael Garza, and I have the distinct honor of serving as the chair of the Cook County Health Board of Directors. First, I want to thank President Tony Preckwinkle for her unwavering dedication to health and the well-being of all Cook County residents. Thank you to our Cook County commissioners for their not just their advocacy, but their fierce advocacy. And I think you get a sense of that standing up here today. But if you don't, you should know that through the course of their work. They've been very committed. I also want to recognize the colleagues who I serve along with on the Cook County Health Board of Directors. But most importantly, I want to thank and recognize the entire world-class Cook County Health team. The professionals that deliver the services that we're touching on today, and that's led by Dr. Eric Mckitis, who will follow me in a short minute here, thanking them for their leadership. Yeah, I agree. Today marks a really critical importance for the day that it is, August 5th. It's one more important step in a long history under the President's leadership, under the County Commissioner's leadership, in ensuring that there's an ongoing commitment to advancing the health equity and supporting the reproductive health of all people in our communities. And we're talking about a spread or a coverage area of over 130 municipalities, cities, villages. That's a huge scale of responsibility that the county has. And in today's climate, you've heard the commissioners touch on this. In today's climate, when comprehensive reproductive health care is becoming more and more difficult to access in so many parts of this country, it's even more important today than it ever has been that we stand firmly with women and the organizations that work every day to protect the autonomy and the well-being of those people we're serving. The $2 million grant reflects so much. Certainly starting with Cook County Health's belief that access to comprehensive reproductive health care, including abortion, is a fundamental part of public health and a cornerstone of social justice. The Chicago Abortion Fund doesn't need a introduction. They have long demonstrated the ability to reach those in our community that are most impacted by these systemic barriers, and let's just call them failures, because at some point this is a decision that's being made. Cook County Health, I would say, is proud to support this investment, and by supporting this work, we're helping to ensure that the reproductive care is accessible to those that need it the most. It is our responsibility as leaders, all of us, in the Cook County Health system to champion the dignity, the human rights, and the access to care at every level. Thank you to the Chicago Abortion Fund for your tireless work. And I am familiar with it in the work that I do outside of Cook County. And thank you to all the partners and the advocates for continuing to push for a future where a person can make decisions about their body and their life in a safe and supportive, respectful, in an environment that allows them to feel there's a sense of dignity there. Thank you for having me here today, Madam President, and as I said, I'm proud to serve as the chair of the Cook County Health Board. At this point, I want to turn it over to the gentleman that has the massive responsibility of really moving this health system forward under the most complicated times I could think of. Dr. Eric Mckitis, thank you.
Chair Garza. Good afternoon, everyone.
Good afternoon.
Thank you. As you heard, I'm Dr. Eric Mckitis, CEO of Cook County Health, and I'd like to recognize and thank President Preckwinkle for her stalwart advocacy of women's rights. She's been a true champion in this area throughout her career. I'd also like to thank Commissioners Anaya, Degnan, and Miller for their support of abortion care, as well as our health system and their support across the county. And of course, thank you to our Board of Directors, including Chair Garza, and Finance Chair Ryder for their support of this grant, which will be voted on later this month. I'd also like to recognize and thank Dr. Lauren Smith and Christina Urbina for their work in this space, and recognize Kidsia Sharif, as well as her team with the Chicago Abortion Fund. Thank you for being here. Ensuring access to abortion is not only a critical part of healthcare, it's a matter of equity and human rights. The freedom to make decisions about one's reproductive health is central to personal agency, self-determination, and full participation in society. Barriers to abortion care often fall hardest on communities already facing systemic inequities, limiting pathways to stability, education, and financial independence. Before abortion was legal, Cook County Hospital saw the harsh reality of criminalizing abortion. The hospital had an entire 40-bed wing dedicated to treating sepsis in women who had no other option but to seek an unsafe, unregulated abortion. The passage of Roe v. Wade was a triumph for abortion rights, but it didn't necessarily ensure abortion access. In Illinois, we benefit from legal protections that affirm the right to reproductive care, but we cannot ignore the fact that women's rights have been taken away in many other parts of the country. At Cook County Health, we are committed to delivering compassionate, high-quality care that puts patients first, including access to reproductive services for all who need them, regardless of background or income. Cook County Health offers medical and surgical abortions as part of our full-service reproductive health care program, and we're proud to support community partners, including Chicago Abortion Fund, in ensuring access to care. These grant funds will provide the resources necessary to remove barriers to care for women in Cook County and beyond. Thank you all for joining us today, and unless there's questions, I think we'll probably take some pictures.
All right, good.
Okay. Any
Are there
questions?
any questions?
I do. Mary Norkel with the Sun-Times. I'm wondering if you can expand on how the Chicago Abortion Fund was chosen, and just like the process of selecting them.
Yeah, so it's our typical procurement process, competitive bid. Chicago Abortion Fund, I believe, was the sole respondent.
And then is there any detail on what exactly specifically the grant should go toward, any parameters surrounding that?
So it's generally intended for wraparound services to help with transportation, childcare, stay while they're in the area.
I think that's it.
Okay, thank you.
Thank you. Thank you all. So we're gonna take a picture?
Yes, we are.
All right, let's